It was in December 2019 when an outbreak which originated from Wuhan, China, took over the headlines. The disease caused by this new strain of coronavirus has been officially called by the World Health Organization as COVID-19. January 30, 2020, the Philippine Department of Health reported the first case of COVID-19 in the country. And just this March 7, the first local transmission of COVID-19 was confirmed. To further prevent the spread of the virus, the Philippine government came up with a national strategy against the COVID-19 pandemic, the DITR operational methodology. DITR stands for the four phases of the operational methodology: detect, isolate, treat, and reintegrate. The detection phase involves the conduct of contact tracing, detect the carriers and potential carriers, implementation of the ECQ, and the preparation of isolation and treatment facilities. The second phase is the isolation of carriers. That involves the relocation of COVID-19 to designated treatment and isolation facilities, as well as the gradual downgrading of ECQ to home quarantine or HQ. The third phase is the treatment phase. That involves the treatment and rehabilitation of COVID-19 and their eventual reintegration into the community, as well as the patients under suspect and probable cases. The last phase is the reintegration of healing patients. That marks the recovery phase and the end of crisis. Once the strategy is nicely done and followed, a gradual normalization will be implemented with preventative measures. There is also a possibility that there will be an extension of quarantine in other remaining affected areas. To keep everyone informed during the course of the implementation of the national strategy, the DOH and the Presidential Communications Operations Office, together with local government units, work hand in hand to disseminate information all throughout the country. Communication efforts include regular talk to the nation of President Rodrigo Roa Duterte, daily press and public briefings of the cabinet members, constant curation and updating of the official government portal, www.covid19.gov.ph. Meanwhile, the Philippine government assures everyone that plans are in place to make our lives as comfortable as possible. Funds are allocated to ensure everyone's welfare. Food supply is sufficient and supply chain remains unhampered. All government resources are utilized to support the fight against COVID-19. Measures are in place to mitigate social and economic impact caused by the COVID-19 pandemic. Hospitals and pharmacies, groceries, wet markets, banks, water and electricity, internet, telcos, and other essential services continue to operate. Nurses, doctors, police officers, and the armed forces, barangay officials, and other frontliners are equipped with protective gear. Contact tracing is intensified by using all platforms, such as mobile applications, hotlines, and barangay centers. There is no cure yet. Thus, we are facing a new norm that focuses on social distancing, proper hygiene etiquette, and the discipline to be part of the solution to mitigate the effects of this global pandemic. The government's action plan is anchored on a whole of nation and a whole of community approach. This means everyone from all walks of life, Luzon, Visayas, and Mindanao, is part of this fight. We dig deeper into our Filipino values of resilience and faith to hope for the best, of strength and compassion to prepare for the worst, that together, as one nation, we heal as one.